We work on a lot of hip conditions in the office as well, and a lot of times they're mistaken for a sciatic or they're mistaken for any other problems that could be happening in there. You'll hear about bursitis, those kind of things. A lot of times I feel like bursitis is secondary to what's actually happening inside the hip joint. So it's very easy to test this thing out, and we'll treat what we call in the office a superior hip complex. I'll bring the leg up, look for proper rotation to the inside and to the outside. If I see a restriction, especially bringing the leg out, that would be a rotation inward of the hip. That's what we're gonna go and work on. A lot of times what will happen is the glute muscles will get really tight because that hip's in and it's jammed up into the socket. So the treatment is gonna be to work on these glute muscles, strip them out, make sure the quads and the hamstrings in the back are doing their jobs. Specific work on what's called the TFL muscle, which is the outer line muscle on the hip here. We gotta get that thing loose and able to move. And then we'll do drop piece adjustments to where we can move the hip, pulling out and rotating around, putting the hip back in the proper position, letting the muscles go back to the proper position, the patient gets better. Almost always, we can go back and test, and you're gonna see a dramatic improvement of range of motion immediately, most of the time, one visit.